Hello everybody, very happy to welcome you back to Beginner's Corner channel. I am Mrs. Brammu, Assistant Professor, Nursing Foundation Department, to share a few messages on what are the do's and don'ts of bandages. And in this session, it will be both theory as well as practical. So in this session, I'm going to only go in for a lecture series, and regarding the practical session, you will be watching in the future videos. So stay tuned. So let's go into the session. So at the end of this particular topic, you'll be able to define what is bandaging. You'll be able to list down the purposes of bandaging, as well as what are the major types of bandages, what are the common materials that can be used at the bedside for bandaging the patient, and point out the different parts of bandages. As well, you'll be able to describe what is the size, need for bandages, and of course the principles, steps of procedures, and detailed list on the different types of bandages. So coming to the introductory part, can you find or can you say that what is bandaging? Yes, bandages or bandaging or dressing, it's more commonly synonymous. That is, both are the same. Might be you receive a patient in the emergency room with might be a sort of wound. It can be deep or might be superficial wound. So as a nurse or as a student nurse, what are we supposed to do? Of course, as you all know that you have to do a deep wound assessment very in a quick and rapid session. But after then, what is the major procedure we undergo to the patient is that we will be doing the dressing as well as we'll be covering up the wound with bandage. So these both are commonly synonymous, and here you can see in dressing, dressing is a very vast topic where you will be having different types of solutions used. You will be having different types of the nowadays there are dressings which are already tinged with the antimicrobial solution such as chlorhexidine solution, or it can be some sort of dressing with the thing like it is going to cover the full wound. So here dressing is a separate major topic where you will be detailedly discussing about the different types of dressings which is used. But to hold the dressing intact, we do a major procedure which is bandaging. So bandaging is a process by which the wound or injured part is covered and protected by a layer called as bandage. So coming to the definition of bandage, as we already saw in the introductory part, bandaging is a process of covering the wound or might be a particular injured part. So as I told you, dressings are majorly going to cover the open wound, maybe to prevent the contamination as well as to control the hemorrhage. So in basically, whenever we give first aid, we do the self-adhesive dressings or gauze dressings. So there are different types of dressings, as I told you. Either the wound is only covered by applying the medication or ointments or solutions onto the wound, and then we cover with large amount of like thick pads or maybe gamgee pads or gauze dressings in order to control the growth of bacteria. So by this, the wound healing will be taking very faster unless there is not any contraindication for closing the wound. So the major purpose of bandage is that the, as we all know, it is going to support the dressing. It's going to prevent the fall of dressing from the wound. It can be either a septic wound or might be it is a surgical wound. So the main purpose of bandage it is that it is going to cover the wound. Then the second major purpose might be what? Yes, it is the fracture or dislocation. In order to immobilize the particular part, you can do a sling bandage or in order to prevent the dislocation, further dislocation, we can do a triangular bandage for the patient, and we can splint that particular part as well as to immobilize the injured part, and it's also going to relieve the pain for the patient. It's also going to control the hemorrhage in case there is a heavy bleeding. It is also going to help to correct the deformity, and this also maintains the pressure, that is elastic bandages applied to improve the venous return. So there are different types of bandages which we'll be seeing in further slides. So here I would like to coin a major point is that the elastic bandage is nothing but the Crepe bandage, which is going to reduce the pressure in and around the area, and as well as you can see it is going to improve the circulation, and thereby the edema or swelling can get reduced for a patient with any edematous condition. So coming to the discussion on point of types of bandages, the bandages are of three major types. You can divide into triangular bandage, which is in the shape of a triangle, roller bandage, which is in the shape of a roll, and special bandages such as T-bandages, which is going to actually help for a patient in the post-operative period. So the major articles used commonly for bandages is that either we can use cotton types of materials or jute type of materials or wool type of materials, or even some sort of elastic bandage, which is your crepe bandage. And of course the articles which we use is that to cut out or to stop the bandaging. If the wound is very small, you can use the small roll. If the wound is very big, then we have to plan in for a bigger size of bandage roll. Adhesive tapes to secure the bandage after you have applied, and of course the padding materials if necessary, kidney tray to collect the waste, and mackinac and towel to protect the bed and bed linen if there is any discharges for the patient. So coming to the parts of roller bandage, there is a head and a free end, or you call it as the tail. So this portion is the head portion, and you have the tail over here, which is the free end. So with the free end, we are going to use the full bandaging techniques, and this is how we hold the bandage as well. The roll must come into the palm and should not go away from the palm. So coming to the parts of the triangular bandage, you have a base, you have two sides, and the apex which is on the top, and you have sharp ends, left and right ends. So the sizes of bandages is that starting from it is depending upon the part we are going to cover. If the patient is going to get covered around the head, then you must have a width of around 5 centimeters, and the length of the bandage must be around 4 to 6. If you're going to cover the part of the trunk, which is your chest or thorax, then the width of the chest, that is the bandage must be 10 to 15, and the length of the bandages must be around 6 to 8 meters. If you're going to apply onto the patient's leg, of calf muscle or thigh muscle, then plan 6 to 8 width, as well as the length must be 4 meters in length. And in case if it is an arm, it must be around 5 to 6 centimeters width, and then the length must be around 3 to 4 meters. If you're going to cover only the fingers, then you must need a width of very small size, which is 2.5, and the length of that particular bandage must be around 2. If it is on the hand and wrist, it's like both the inches are going to be the same, the width size 5 and 5, and as well as the length of the bandages will be 3 and 3. So actually why we are using these, you have to have a common idea behind this, because only if it is too lengthier, then it is going to become a mess when you are going to do the rolling technique. Even if it is very short in width, then you can imagine that the particular part will not be covered. So please try to understand the importance of why the width and the length are being advised in case of bandaging. So like as it is in very concise manner. We have completed up to the sizes. The remaining we'll see in the next video. Stay tuned. So these are the common frequently asked questions like what are the parts, what are the types, principles and purposes of bandage. And this is just a 5-minute assessment on what you can understand from that particular bandage. And these are the possible references which I've used. And thank you so much for your patient listening. So stay tuned to see on to the next video on what are the major principles of bandage. As a nurse, we have to follow the principles whenever you're going to apply bandaging technique, whether it is on a clean wound, contaminated wound or surgical wound. Thank you.